Hi everyone, my name is Bridget Weinman, and today I'm going to be talking to you about dementia. So, what is dementia? Dementia is not a disease, but a general term for impaired memory or memory loss. As we get older, we may experience memory loss, such as not remembering where we placed our cell phone, forgetting the name of a neighbor, or not being able to find a word as easily. So, dementia is impaired memory, such as getting lost in the neighborhood that you've lived in for 20 years, forgetting that you are married, and using incorrect words or replacing them for other words. There are different types of dementia, and that includes Alzheimer's disease, vascular dementia, and frontotemporal dementia. The next slide is going to explain a little bit more about these types of dementias. So this image was taken from alzheimers.org, and I think it's a great visual to explain the different types of dementia. So as you can see, dementia is represented by a large umbrella, and that is because it's a general term for loss of memory. Alzheimer's is the most common type of dementia and causes loved ones to forget something that they might have just done moments prior. Lewy body dementia can cause imbalance, trouble sleeping, and hallucinations. Vascular dementia is caused by strokes or blood-related issues, and frontotemporal dementia affects the part of the brain that controls personality and behavior. So as social workers, we all understand the importance of the NASW Code of Ethics, but I wanted to highlight parts of the Code of Ethics that stood out to me specifically when working with those who suffer from dementia. So first, I wanted to go through the core values. The dignity and worth of a person can sometimes be forgotten when working with the older adult population, specifically those with dementia, because of their inability to advocate for themselves. So when someone has end-stage dementia, they might forget who they are, where they are, and their body will begin to slowly shut down. So I feel like we as social workers must continue to value the life as if they were fully aware of the situation. Importance of human relationships is highlighted because it is so important for someone with dementia to continue to have relationships with others, and I will go into more detail with this later. Lastly, integrity is highlighted because as social workers, we must always be honest and truthful, even when working with a population who might not remember what services we are providing. As for the ethical standards, I highlighted self-determination. It's important to continue to encourage those with dementia to maintain independence and highlight their strengths. I think this also coincides with dignity and worth of a person. Cultural awareness and social diversity is imperative to understand when working with those who have dementia. Understanding the person's background might help the social worker uncover why the person is acting a certain way. So, for example, when I was working as a social worker for a nursing home, I had a resident who had dementia, and she was Italian, and she used to make homemade pasta as a little girl. And so this is something we would reminisce with her about, and it would make her feel happy, safe, and comfortable in the midst of her confusion. So lastly, there's privacy and confidentiality, and that must remain important because I think it complements the value of integrity. Just because someone has a cognitive impairment does not mean we as clinicians should not respect their right to privacy. So these next slides are going to explain some studies I found regarding dementia. The first is about the Dementia Early Stage Cognitive Aids New Trial or DESCENT. This trial was used to promote self-management of symptoms caused by dementia. The authors used goal-attained scaling to identify each participant's goal, making the study personalized and goal-oriented. And it was found that the most common goals to achieve were to maintain orientation, that's orientation to time, person, and place, and to maintain as much independence as possible. This is a screenshot from the article, and it shows a participant's goals that they chose. And based off the goals, you can see how dementia has an impact on activities of daily living, and it puts into perspective how we can take some of these things for granted. So previously I mentioned I was going to go more into the importance of human relationships. This study focuses on human relationships with someone who suffers from dementia. So, whatever the relationship might be, dementia can have an impact on it. When living with dementia, one may feel they are losing their identity. And not only are they losing their sense of identity, but they are also going through the loss of relationships. So, this study followed 13 people caring for those with dementia. It was founded that dementia had a large impact on the relationship which included the factors of gender, sexual intimacy, and caregiver quality. Depending on who in the relationship was suffering from dementia, gender roles can be tested, causing a strain in the relationship. It was also founded that sexual intimacy was negatively affected by dementia and that couples would just resort to holding hands rather than something more intimate. Lastly, dementia has an impact on caregiver quality, and the study showed that caregivers who had a weak relationship with their loved one prior to the dementia were not as sufficient of caregivers compared to someone who had a strong relationship with their loved one. I think after this past year, we all have come to realize how helpful technology can be. And so, this is a study about a gentleman who was diagnosed with somatic dementia. So, first off, technology aids are something that you would use to help with your daily life. So, for example, the calendar app in your phone to help you keep track of appointments and things like that. So, this gentleman was followed for 5 years. First, when he received his diagnosis of somatic dementia, which is a dementia that affects word finding and will affect your communication skills. So he was taught the technology aids on his smartphone, and then 5 years later, the study found that he was able to have some recollection of the technology aids, specifically note taking and email, which allowed him to achieve one of his main goals, which was maintaining independence. So, some questions to consider are: how would I react if my loved one was showing signs of dementia? How can social workers prepare themselves to work with those suffering from impaired cognition? What would I fear most, impairment of my cognition or physical impairment? How do I advocate for someone with dementia? How would dementia change my relationships with others? So, some interventions that a social worker could use when working with someone with dementia is narrative therapy, which is reminiscing with the patient or resident. And this helps them with their long term memory, and it also allows them to feel comfortable and comforted. This is also a therapy you can do. You can incorporate the loved one or caregiver of the patient with dementia. Cognitive stimulation therapy happens in a breakdown of sessions, and it focuses on certain tasks such as finances or maybe current events. And this is a therapy that is used with someone with mild dementia. There's validation therapy, which allows the social worker to validate or help the resident recognize what they're feeling. This is something that you would not use with someone with a type of dementia that causes hallucinations, such as Lewy body dementia. And that's because in that moment they are feeling very distressed. So you wouldn't want to add more to the negative feeling that they are experiencing. Music therapy, we touched base on in class a little bit, and how that helps trigger memories, and something that can also be incorporated with the family. And some personal experiences I'd like to mention is when I worked in the nursing home, we would gather as much information as we could from family members and loved ones to find out about the resident. And let's say, for instance, they were a homemaker, we would then provide the resident with a baby doll, and they would feel that that was their purpose, to care for the baby doll. So, dementia and the micro level. Dementia has effects, as we have learned, in relationships. So, that can hit the micro levels of individuals, couples, and families. And a social justice issue that can come about because of dementia is the issue of abuse. Because you're already working with such a vulnerable population, they are at a greater risk to experience abuse, and that could be physical, financial, and even self-neglect due to their cognitive impairment. Lastly, we have dementia and the macro level. Something that is being affected in the community is the cost of healthcare, and dementia is contributing to that rise in cost of healthcare. There are laws in place to help protect people who have cognitive impairment based off of their capacity. Someone has the right to their own opinions and choices as long as they obtain capacity. And that's something that we must respect. Some organizations that are available are the Alzheimer's Association, Dementia Society of America. There are support groups in the hospitals and churches. And it's also important to continue to educate ourselves as clinicians so that we can educate others about those with dementia. So these are my references. I hope that you were able to learn a little bit today about dementia, and I hope you found this video helpful. Thank you.